Today we are going to demo positioning paralleling for anterior. Okay. First thing we would always do is turn on the machine. Okay. And then we are going to make sure that we set our control panel to adult, regular speed film, and to lateral and to canine. Lateral and centrals. Okay. Lateral and centrals. Okay. You make sure our mannequin's together. He's ready to open. We get him open. Okay. And now we're going to zoom in. Now, one thing you have to remember is that the palate of the mouth is different for everyone. Some people have very deep palates. Some people have very shallow palates. So you have to make sure that you get a feel for what it is that you're dealing with. Okay. Notice that I bring the tube head already over to where I am. I have it ready to go so that as I'm positioning the Rin instrument, I'm not having to then go back and get the tube head, because what happens is the patient gets really antsy, it starts to hurt them, okay, discomfort, and then they want to pull it out and then you've wasted time. So if you have it right here close to you, then it's easy just to grab and position it once you already have it. Okay? So because of the roots of the teeth, you can't see them, but the centrals are here, correct? And that's what we're going to center on first. But the roots are going to be curved back like this. Okay? It's going to be curved like this. Alright? What I saw a lot of people doing was you were trying to, let's see if I can get this in here. Trying to get the film, trying to get the mannequin to just bite down straight like this. And then they couldn't bite down. You were making them bite down just straight. What you have to do instead of that is angle it. Put the bite stave more towards the tongue. Okay, so you're angling it up so that you're able to get that and go more towards the midline and the inside. Okay, you go further back, then you close down. Okay, now I'm going to zoom in so you can see what I just did. Okay. Notice how it's at an angle. Okay, see the angle that it's at? It's at an angle. Also, that if we look really close, let me zoom in a little bit. See if I can get it focused, excuse me. Okay, so it's at an angle, and there's a little bit of the bite stave sticking out at the top, and I'll zoom in so you can see that. So a good number of you had where you cut the incisals off, and it was because of the fact that they were biting towards the tip of that bite stave and the bar. So you see how you want to leave a little bit of that bite stave sticking out? The bite stave is more towards the tongue. See how it's angled like this? And that makes the film go parallel like this versus straight like this, which they wouldn't be able to close down. Now the film is like this. Okay? So the next part of all this is paralleling. So we now have the film parallel. The teeth that you're focusing on, which are the centrals, are biting right smack in the center of that bite stave. Okay? So the next thing that we would do now is move the ring further in. Okay? Not touching the patient, but further in. Okay? And then we would bring the tube head up. And if I need to move my extension arm, I do. I bring the tube head down. I look at my line and my indicating rod to see that they're parallel. Okay, so I look to see if they're parallel, and I'll bring you back that way again so you can see through this side. Okay, I look to see if my lines are parallel, and they are, but I'm not finished yet because I can't just look at one side of the coin, so to speak. I need to come to this side and look. Okay, so this side looks completely perfect, correct? I'm going to show you exactly what you would see on the opposite side. See, it's not parallel on this side. Okay, so what looks good on one side isn't the same on the other. So now what I need to do is go back and adjust the other side, which I will do right now. Okay? Okay, that's good on that side, and yet it's not good on this side. Now I can say I got it on both sides. And just to show you, I'll show you this side. Again, I'm going to lift you up, bring you this way, and now you can see on the opposite side is parallel also. So now I'm sure that my film is parallel, because I showed you that before. I now check the indicator rod, right here, the indicators on the sides. I check the film and I check the ring on both sides. Now I'd be ready to go. Okay? If I were doing this for the lateral, then I would be focusing in on the lateral. And so I would move this up and zoom in so you can see where the lateral would be. Okay? Okay. So, see if I can get you focused. It still looks a little bit. There you go. So here is my lateral, my canine. I take my bite stave, okay, take my film again. Now I move this back and I go straight in more towards the midline, and now the lateral is focused and biting right on that bite stave. Okay, I'm going to show you if I can. Lift it up carefully and then show you what I'm talking about when I say that. You can see right there, let's go right through the ring, that if this were a lateral one, perfect, as much as I can in there. Before it was the centrals, okay, and now it's the lateral. Now let's see if we can see what it looks like in there. Won't let me go any further, but you kind of get the idea of what I'm talking about. What it is that you're focusing on should, as much as it can, be centered right on that bite stave. The film shouldn't go in straight like this because they wouldn't bite down. You got to angle it more like this, okay, to make it parallel with the roots of the teeth, and then of course all the other stuff, the cone, the setting, okay.